Hello, my name is Peter Lawrence, and I'm pleased to introduce the November issue of the Journal of Vascular Surgery, Venous and Lymphatic Disorders, and to highlight 4 outstanding papers which are freely available for the next 2 months. The editor's choice article for this issue, which you can see on this slide, is called 5-Year Extension Study of Patients from a Randomized Clinical Trial Comparing Cyanoacrylate Closure versus Radiofrequency Ablation for the Treatment of Incompetent Great Saphenous Veins by Morrison and co-authors. They did a long-term study, which is shown in this visual abstract, which was a continuation of an earlier trial that showed that non-tumescent, non-thermal cyanoacrylate was not inferior to radiofrequency at 36 months. In this 5-year study, 89 patients completed it, with 47 in the cyanoacrylate group and 33 in the radiofrequency group. At 60 months, the freedom from recanalization was 91% and 85% respectively. Both groups also demonstrated sustained improvement in quality of life, and over half of all the returning patients were reclassified at least 2 SEEP clinical classification categories lower than they started. Our next highlighted article is the clinical relevance of the anterior accessory great saphenous vein reflux by Schul and co-authors. They address the prevalence and disease severity of the anterior accessory saphenous vein compared to the great saphenous vein, shown in this visual abstract using a large venous database. 2,664 patients had reflux in their anterior accessory saphenous vein, great saphenous vein, or both. The database also documented SEEP classification and the venous clinical severity scores in many patients. 14% of patients who had no prior venous interventions had anterior accessory saphenous vein reflux, and those who had a prior ablation of the saphenous vein also had a high likelihood of both anterior accessory saphenous vein reflux and increased clinical severity score. In addition, the proportion of anterior accessory saphenous veins with superficial thrombotic events was 13%, and this was significantly higher than in patients with great saphenous vein reflux, who only had 3% with thrombotic episodes. The authors concluded that the anterior accessory saphenous vein and its reflux is common and carries similar morbidity to the great saphenous vein. It also presents with a significant incidence of superficial vein thrombosis. The third article by Cheng and co-authors is entitled Biomechanical Impact of Hip Movement on Iliofemoral Venous Anatomy and Stenting for Deep Vein Thrombosis. In this cadaveric and human study, which is shown here in this visual abstract, they evaluated the biomechanical impact of hip flexion. Stents were inserted into cadaver veins in the iliofemoral region. The vein was then pressurized and then studied with CT angiography at various hip angle positions. In addition, 21 patients with iliofemoral vein disease had pre and post stenting CTAs in the supine position. In cadavers from supine to 30 to 45 degrees and 50 to 75 degrees of hip flexion, iliofemoral vein stents became less compressed at 4.5% with a minor diameter expansion, and the inguinal ligament was separated from the iliofemoral veins by up to 3 centimeters in all hip positions. In patients, the pubis compressed 47% of the femoral veins, and 78% were within 3 millimeters of the pubis. There was also evidence of contrast-enhanced flow disruption at the superior ramus. Contrary to widely accepted dogma, the common femoral vein is not compressed by the inguinal ligament during hip flexion. It is compressed by the superior ramus of the pubis during hip extension. The final article highlighted this month is called Interim Results of Bleomycin-Polidocanol Foam Sclerotherapy as a highly efficient technique for venous malformations by Yang and colleagues. They reviewed the clinical and radiographic outcomes of patients with venous malformations treated with a combination of bleomycin and polidocanol foam sclerotherapy, shown in this visual abstract. This is a combination of two drugs that have each previously been reported to treat vascular malformations. 55 patients were treated with bleomycin-polidocanol foam using standard sclerotherapy techniques. There were 111 sclerotherapy sessions with an average of 2 treatments per patient, using a mean of 10 cc's per procedure, with a total volume ranging from 2.5 to 30 cc's or milliliter. At a mean follow-up of 14 months, all 55 patients reported improvement in their symptoms, with a good to excellent response in 95%. Post-procedural MRIs demonstrated a significant volume reduction of lesions in 98%, with an average lesion volume reduction of 85%, and no major complications occurred. 12% did have minor complications. The authors concluded that bleomycin-polidocanol foam is safe and effective and can be first-line treatment for venous vascular malformations. Thank you for watching. For more information, please follow us on social media and remember to like, comment, and share. We hope you enjoy these 4 highlighted papers and the other excellent papers in this month's Journal of Vascular Surgery, Venous and Lymphatic Disorders. Remember that these articles are free to read until the end of December. And thank you for your attention.